Hello, family and friends. Um, I'm Jennifer Clark, for those of you who this may be reaching that I don't know. I'm a physician and a healthcare delivery scientist. I live in Tulsa, Oklahoma, and am working at the state level to help the fight against COVID-19. A couple of friends have asked that I share my thoughts, not only as a physician, but as a fellow human being. And hopefully, the big message that you take away from today is that you have a lot of power in this, and that you can be safe and not scared. What do we know about COVID-19? We know it's a novel virus, which means it's new to our immune systems. The human body hasn't seen it before, and is the reason why we see such a different response in different people. We know it's a disease of what we call virulence, volume, and velocity, which means many of us are going to get sick really fast all at once. This is where the whole flattening the curve has come into play. Most of us will suffer a mild illness. 80% of us will either not feel anything at all, or have a typical kind of cold-like viral illness. But there's a subsection of us, about 20% of us adults. We see very little illness, if none, very few cases of pediatrics, meaning kind of under the age of 14 and even up as high as 20, as well as pregnant women and their babies. There seems not to be such a significant risk. But people who are kind of adults, particularly kind of over the age of 20 and older, 20% of people that get sick could develop one of two other manifestations of the disease. One, they could develop a non-life-threatening pneumonia. And that group is the group that is the biggest amount that's hospitalized and is causing a lot of problems for us folks in the healthcare system, and making sure that they get the treatment that they need. But there's a large majority of them. And unfortunately, there's about of that 20%, that's about 15%. And then there's another 5% that get really, really sick and need ICU care. But sometimes they get lost in that big sea of people. And so, kind of really helping sort everything out is important. But just know the takeaway point for you guys is that 80% of us are going to do fine. 20% of us may have something that requires hospitalization. And so, it's a piece of information that makes it powerful, and reminds you to do the 5 rules that we'll talk about here in a second. We know that it's transmitted by droplets. It means basically you touch a surface or you touch someone else and then touch your face, like your eyes, your nose, or your mouth. We know it's also pretty lazy in that it doesn't travel very far. This is where the whole 6 feet, kind of social distancing piece comes from. We also know that it's pretty much a wimp. It dies immediately upon disinfection. But despite the fact that it's lazy and kind of wimpy, it still is pretty highly infectious. And when I say that, what that means is that, when you are in close contact with someone for a prolonged period of time, so greater than 15 minutes, that's where we see the biggest risk occur, particularly if you're not wearing protective equipment. So you hear about all the controversy around PPE, or personal protective equipment, for us healthcare workers. And this is why it's so important, because our healthcare workers, and gosh knows I have so many in my circle of family and friends, are willing to don that PPE and take care of that, kind of 20% of us that are going to get sick. But we need to make sure that we do our job, to make sure their job is a lot easier. The other interesting thing about this disease is that's the first pandemic in the social media age, and it's creating kind of this thing called the infodemic, which is, kind of this vast amount of information that is causing unnecessary psychological harm. So just be careful about what you read and what you watch. Again, know that you don't have to be scared. You just got to be really, really safe about what you do on a day-to-day basis while we live kind of in this era. So what can you do for kind of what can we do for ourselves and for the ones that we love? Basically, it comes down to these 5 simple rules. 1, you got to wash your hands. Always know where your hands are and where they have been. If you touch anything or anyone outside of your house, immediately wash with soap and water for 20 seconds and use 60% alcohol hand sanitizer. Keep something in your pocket. And, just remember you have a lot of power in that. COVID doesn't withstand sanitizing. So just, be smart. Always know kind of where your hands are. Second part of that is don't touch your face. That's a bit like asking a fish not to swim, because as humans, we touch our face a lot. But dirty hands on a face, particularly your eyeballs, nose, and throat, essentially equals COVID. And so when you are particularly headed out of your kind of safe environment of your home or your neighborhood, it may be wise to go ahead and wear a handmade mask. I'm not talking about the N95s. I'm not talking about the surgical masks. I'm talking about the ones that you're seeing pop up on YouTube and Pinterest, and that you can make at home, that, kind of covers the most kind of vulnerable parts of your face so that you don't touch it when you go out. The other thing is that the mask also helps you, should you have the virus, not spread it to others. So it's really important to keep your hands, know where they are, and don't touch your face. And one of the strategies is to wear a mask. Keep your distance. As I said, this guy doesn't travel very far, but, when possible, stay at home. Stay in your home environment, but don't be afraid to take walks, be outside. And when you have to leave that safety zone and move out into the world to get the necessities like groceries or medications, always be mindful, again, where your hands are, not touching your face, and keeping that, kind of 6 feet between you and the next guy. The 4th and 5th thing really get down to family. The 4th is circle up. Here in the Midwest, we talk about circling the wagons. And that's what this really means, is that you identify what we call your isolation group. So your kind of group of people in your zone of safety. And most of the time, this is just who lives with you on a day-to-day basis, what your household is. And you set up clear boundaries. Bottom line is you don't let anybody in. This is extremely important, not only to protect those in the household, but particularly those who are of those vulnerable populations, those people who are over the age of 65 or have medical conditions like high blood pressure or heart disease, diabetes, obesity, and cancer. Communicate. That's number 5, is to communicate. Like I said, very, very few of us are going to have to come into contact with this disease. And if we do, we're not going to have issue with it. But there's a small group, very small group, that our lives are going to be threatened. And so because of this possibility, it's time to have those difficult conversations, especially if you're over the age of 65 and or have one of those medical conditions we've talked about. There may come a time where you can't speak for yourself, that you may become so sick that someone will need to speak on your behalf. Having these conversations and documenting your wishes will help us as doctors and your family honor what matters most to you. So 5 big rules. Always know where your hands are. Keep them clean. 2, don't touch your face. If you need to, use a mask to help you protect yourself. 3, keep your distance. 4, circle up. And 5, communicate. So what happens if I do get sick? One of the biggest questions I've gotten so far is, how do I differentiate this thing from colds, flu, and allergies? This is a pretty good chart that kind of was from the Oklahoma State Health Department that can kind of help you sort through that. But COVID's pretty clear. Most people during the course of their illness develop a low-grade fever. I'm talking like 100.5 to 101. So 101, 100.5. Most people have a dry cough that goes with it and maybe some body aches or headache. If you're feeling that this time of the year, you probably have COVID. You want to stay at home and quarantine yourself, which means staying away from the rest of the people in your home, because what we're seeing is that's how the disease spreads. Again, close contact for long periods of time. So quarantine yourself, and when you come out of your room, kind of wear a mask and make sure that you're conscious of where your hands are. Again, practicing the 5 rules so that you can disinfect for those of us that are leaving that house beside you. That should last about 14 days until you have no symptoms. We want you to use Tylenol for aches and pains rather than ibuprofen. We've seen some kind of weird stuff happen with it, may cause harm. If you need to talk to a doctor, use telemedicine. Avoid going to a clinic, and definitely avoid going to the emergency room. Testing. We've had a shortage in the United States. And so only seek testing if your area has more than enough tests and is using it broadly in your community. Otherwise, the test isn't really going to change, kind of the plan for you. However, should you develop shortness of breath, and I mean I'm sitting here on the couch and I can't catch my breath, or if I'm doing my daily walk and it's really, kind of taxing me, you should seek medical care. Shortness of breath is one of those canary in the coal mines with COVID-19 that tell us that you might be in that higher risk group. So definitely reach out to your doctor or immediately seek medical care in urgent care or ER. I'd really like to thank David Price. He's an intensivist or an ICU physician in New York City, and his family and friends, they published an intimate conversation about this same kind of topic. And when my family and friends asked me to put some things together, I didn't quite know where to start. And so I really appreciate his insights and really, allowing us to kind of peek into that intimate part of their lives. So with that said, be safe, not scared. We've got to live despite this thing. And all you have to do is follow the 5 rules. Real simple. Wash your hands. Don't touch your face. Keep your distance. Circle the wagons. And communicate with your family. Love you guys.